in Minnesota start to have a slight increase in their case rates. And so we're reaching out to those states, trying to understand what's happening and see if we can help them more. Let's move to this one, the community transmission levels. So that's by state and territory. This is by county. So on the y-axis, we have over 3,000 counties in the country. So that's count of counties. And then on the x-axis, we have time from January 2020 to March of 2021. And the colors here are similar to the other slide. Red and orange are alarming, yellow and blue are reassuring. And so you'll see in terms of counties, low transmission, and this community transmission, I should say, also includes cases per 100,000, but also percent positivity. So in each county, of all the tests that are done, what percent of them are positive? 10%, 5%, 2%. So we connect those two together and come up with this transmission level. So the good news is that it's going down over here. Here's where we are now. But you see, if you let your eyes follow the contour of the red, you'll see the three peaks of the epidemic in the U.S. Now we have about 27% of counties in the U.S. are moderate or low, and that continues to increase every week. This is important to us because we connect these community transmission levels to our guidance. So we released today or updated our K through 12 guidance and allowing at least 3 feet in the classroom for children. But as community transmission levels increase, we have additional recommendations, more testing of teachers and staff and students, as well as more restrictions around extracurricular activities, because we've seen a lot of outbreaks basically with sports in schools. The last slide I wanted to talk about is this one, and you may have heard a lot about variants. And the virus that causes COVID-19 continues to mutate, and some of these mutations are worrisome. And so we've been following these mutations over time, and some of these mutations may affect our vaccine efficacy or effectiveness, our therapeutics, whether they're effective or not, or drugs, and also our tests, are they useful or not? And so we're tracking, using whole genome sequencing, these variants across the whole country, and we're trying to escalate and expand that capacity now and hope to have a lot more capacity in the future. So just looking, this is nationwide. We're looking at variants nationwide. So we're looking on the y-axis is the variant share. On the x-axis is week. This is time 0 today. So we're looking back 6 weeks, 12 weeks. So this is 3 months ago. So 3 months ago, this variant in teal, let's call it, B1.2 was wild type. So been circulating in the US for a long time. But you see it's being replaced with this variant in olive here, B117. This is the one that we're concerned about in the UK and Europe, and is more transmissible, more infectious. So we're in a race with our vaccination rates, our mitigation, continuing to mask and distance, as we get this type of emerging variant like B117. We think B117 will be the predominant variant in the US probably by the end of March of this month. Now, here in Region 2, I wanted to show you there's variability in the regions. Region 2 includes New York and New Jersey primarily. In Region 2, we see a pattern where this is wild type being replaced by B117, but here in orange, there's another variant that's emerging, B526, 1526. And why is this important? Because, so you see, and it's actually a pretty substantial proportion now, this particular variant is resistant against one of our monoclonals, one of our drugs that we're using for therapeutics to treat. So right now we're discussing within the U.S. government, big U.S. government, around...
Make it clear it's the therapeutics, not the vaccine.
Correct.
Because these guys are picking that up. So
yeah, that's right. So it's a drug. It's a drug that's used, early, but even before you go into a hospital, one of these drugs that kind of prevent hospitalization or might prevent death.
Please understand, I wasn't correcting you. I just know from experience that...
No, thank you.
They conflate it.
Yeah.
No, thank you very much. So anyway, this 526 is resistant against one of these monoclonal drugs, and we're going to give recommendations around changing to separate drugs, maybe combination drugs, that will be effective against this particular variant. So I want to end there, and we can talk more if you have questions. Do you have any questions? Okay, thank you. So let me turn it over to Dr. LeBird.
Thanks, Henry, and let me add my welcome to you, President Biden and Vice President Harris, for being with us in this historic moment in public health. It is such an honor. This will be in our history forever, so thank you for your presence. We observed early in the pandemic that racial and ethnic minority populations were experiencing a disproportionate burden of COVID-19, not only infection, but also severe illness and death. And so with an initial focus